Hello, I'm Dr. Elizabeth Coyne, and I'm just going to go over Module 3 and what's included in that, and hopefully inspire you to finish this course well. So, in this topic, in this module, there's three topics: legal and ethical constraints, and looking at sort of what we need to think about when we're an advanced practitioner, how we are actually changing practice, and what sort of legal and ethical aspects need to be included. We're also going to look at the guidelines and registration, and sort of looking at how this differences as you become an advanced practitioner, if you become a nurse practitioner, if you become with extended practice, such as scope of practice, such as medication administration. So, different aspects in that topic which look at your actual registration and what guidelines you must follow as an advanced practitioner. The other topic within this module is working with minority groups. And this is really important to think about: who are the minority groups in your clinical area? This may be patients, family, or it may actually be staff that you work with that may be English second language. It may be different sort of aspects in gender. And so it's really important to consider this when you're thinking about changing practice, to make sure that you actually are including the minority groups. So, when you're looking at practice change with maybe changing the way education is provided, does it take into consideration of those with English as second language? Does it take into consideration those with lower health literacy levels? So these are things to think about as you're working through the module, thinking about how these different topics influence your practice as an advanced practitioner. So the way they link now, it's really only to assessment 3, this last module. It's really about sort of bringing that clinical information into becoming a practice change. Make sure you read the criteria and the different parts for assessment item 3. And it is linked to your own clinical practice area. So make sure you sort of think about how that practice change that you're developing aligns with the national and international guidelines, how it includes those minority groups, how the legal and ethical aspects are also included. So remember, as you're going through module 3, this course has all been about bringing your practice to be an advanced practitioner. And so hopefully bringing your understanding of your role as an advanced practice nurse, to where you can actually identify the need for change, develop maybe presentations, develop practice change plans to actually improve the practice and the different roles in your clinical area. Think about how it links to your own role and scope of practice as you read over the information, and how you might sort of have different aspects of your clinical practice, and how that links to registration, your scope of practice, and how you really can sort of make sure that minority groups are included in your practice. So the key concepts from this module are really looking at the legal and ethical constraints to being an advanced practitioner, and how we can actually look at minority groups to improve outcomes for them, and to reflect on your own practice area and how, as you have become now an advanced practitioner by completing this course, how you can actually really make that work to improve the outcomes for patients and family in your area. Thank you.